Hey, this is Rihanna.
It's your boy Chris Brown. Yo, what's up, y'all? This is Kanye West.
What's up? This is Alicia Keys.
This is your boy Neo.
Radio at another level.
Invicta
FM.
Now, it's time.
Prescription you've been given. How about the proliferation of fake drugs? Are there proven alternative ways of curing diseases? We've got health tips to protect you from falling ill. Health news, health laws, health policies, stakeholders in health sector, alternative medicine, all of these and more. It's Health 360 Degrees on Invicta FM 90.9.
Every Friday, 7 p.m. to 8 p.m. with Jockey at Derija. Health 360 Degrees.
Embrace victorious health. How many times have you gone to see your doctor and left the office without being any... The time is 7 o'clock.
Your Health 360, only on Invicta 98.9 FM with Jacqueline at Davy Job. All right, good evening, everyone, and welcome to the program, Your Health 360. I truly apologize for the few minutes that we've taken out of this. Dr. Andy Eburaja, we're giving him some time to get himself settled. And so because we don't really have time today, we'll have to end this about 15 minutes to the top of the hour. I would like for us to jump straight into it. A lot of people nowadays complaining about tummy ache, of one type or the other. And many times we confuse the mild ones for very serious conditions. And then, of course, the most terrifying is when we take, serious conditions and treat them lightly. And then many times you hear people were rushed to the hospital after complaining about tummy ache, and then they passed on. So that is why today we'll be taking a look at stomach ulcers versus knowing the difference between stomach ulcers, irritable bowel syndrome, and then a condition called diverculitis. Dr. Andy Eburaja, you're welcome. It's great to have you in the studio.
Thank you so much.
Please move closer so that the people can hear you properly, Doc. All right. Yes. Please, could you handle that for the doc? Yes. And we're live on Facebook, so you could actually go there and drop your comments. Like I said, we only have 45 minutes, Dr. Eburaja. So let's go straight into it. Try to, as quickly as possible, differentiate between stomach ulcers, because all these conditions actually affect the tummy and becoming more common by the day anyway. So what is the difference between stomach ulcers, irritable bowel syndrome, and then this particular condition called diverculitis?
When we consider these three disease conditions, the stomach ulcers could actually be, we call them peptic ulcers. They could actually be either duodenal or gastric ulcers. Now, characteristically, they all present with abdominal pain. But for the irritable bowel syndrome, it's also an abdominal pain, a functional abdominal pain that also has bowel dysfunction. That's your change in bowel habits. You can either have constipation or you might have diarrhea without any functional or organic conditions. Then for the diverticulitis, it's actually usually due to weakness of the outer part of the large intestine, which is the colon. So there's an invagination of the bowel, forming a pouch that presents with similar conditions like also abdominal pain. So three of them all have abdominal pains. But characteristically for the peptic ulcer, which is also the stomach ulcer, the pain is usually under the chest, just a little bit above the belly button, and it's also on the midline. While for irritable bowel syndrome, because most of the times irritable bowel syndrome and diverticulitis. These are diseases or entities that occurs in the larger organs, while the peptic or stomach ulcer occurs in the upper intestinal organ, yes. While the irritable bowel syndrome and the diverticulitis occurs in the larger, that's the colonic organs, intestine. So the symptoms or the presentation of the abdominal pain for the peptic ulcer occurs centrally and just below the epigastrum, that's below the chest. So sometimes they present with like central chest pain, while the other ones present with lower abdominal pain, most of the times at the lower side of the abdomen, at the left flank. So that's the similarities and the differences between all these conditions.
Okay, Dr. Buraja, just so, because you use several technical terms and you need to break it down for us so that those of us who feel the pain will understand what you're talking about. If I got what you were saying right, trying to differentiate between the pains that one experiences for each and every one of these ones. You talked about the ulcer, you said peptic ulcer?
Stomach ulcer is also the same thing as peptic ulcer.
It's also peptic ulcer. But there are different types, right?
Yes, they are.
Okay, there are other ulcers that could occur in other places in the digestive tract?
Yes.
Okay, like which ones and which ones?
Okay, for the peptic ulcer, you divide them into either you have the gastric ulcer, which occurs in the stomach, or you have the duodenal ulcer, which occurs in the upper part of the small intestine. So you had either a gastric ulcer or a duodenal ulcer.
Okay, so let's take it little by little. If it is ulcers, is there a difference between the kind of pain one feels when it's a stomach ulcer and when it is a duodenal ulcer? Are there differences, or it's that same pain above the belly button?
Well, basically, they all both present with abdominal pain, which occurs just below the chest. That's what they present with. And most of the times, the pain radiates to the back just because it's like, what we call it is like a sensory organ. That's from the back, it goes to the front. So it radiates to the back because that's where the supply comes from. So they feel the pain in the chest and it radiates to the back. So both gastric and the duodenal ulcer presents with those kind of pain, chest pain.
Okay. So what about the timing of the pains? Is there a difference for people who have their ulcers, by the way? What are they actually?
Well, ulcers can simply be defined as sores on the lining of the intestine.
Okay.
Yes, the lining of the intestine is called ulcer.
Ulcer.
Yes.
Okay. So if the pain, the timing of the pain, I'm trying to say the difference, trying to find the difference between the kind of sores or ulcers that you find on the tummy or inside the tummy, inside the stomach itself, and the ones that you find along the intestine, the small intestine. Trying to recognize what type of pain you have. Is there a difference? Is there the one that you feel pain after you eat, or the one you feel pain after you haven't eaten when you are hungry? Can you tell by the timing of pain?
Absolutely, you can't really tell from the timing of the pain.
Okay.
But the characteristic thing that happens is that once the person has the pain comes when you're starving or you haven't eaten, or after long periods, or after eating your meal, after hours of eating your meal, then the person now presents with the pain.
Okay.
But some school of thought believe that, okay, the gastric ulcers come when you eat food, while the duodenal ulcer comes after you have eaten food, hours after you have eaten food.
But it's possible for you to have it going opposite direction, like it's a stomach ulcer, but you feel pain when you're hungry, not when you're full, or something like that.
Yes.
Okay. So stomach pain above the belly button, you need to go and see your doctor.
Yes.
Can stomach ulcers prove fatal?
Yes, stomach ulcers can prove fatal depending on the extent. On the acute phase, not really, based on you just present with only pain and some of the other symptoms, maybe like vomiting or diarrhea or bloatedness. But when it gets chronic, over time, there's erosion, and most of them can start bleeding, or they can even perforate and cause sepsis inside the stomach. You have peritonitis, that's infection inside the
So the
abdomen.
patient know.
Yes, usually the patient know because you have like an excruciating pain, unbearable pain that have to make you to go to the hospital. Then some of them end up vomiting blood. It might be frank blood, or it might be an altered blood. It looks like coffee brown, or most of them, if it's very, very heavy, that's if the erosion is much and it bleeds and the vessels bleed profusely, most of them might end up passing bloody stool. Or some of
Okay.
the stools might also be altered. It's a little bit colored.
Okay. So that is for those who suffer from one type of ulcer or the other. When we come to irritable bowel syndrome, I know that medically when they say syndrome, that is because they really do not understand, what it is all about. But what exactly is it?
Well, irritable bowel syndrome, it's a functional disorder that is characterized by abdominal pain, then altered bowel movements. Now, the altered bowel movements can either be constipation, that means you're unable to go to toilet, or you have very hard stool, or the caliber of the stool is changed, or the person might also have diarrhea.
What do you mean by caliber of the
The
stool?
size.
The size of the
Yeah.
stool.
Yeah, the size of the stool.
Okay.
Yes. Then, or you might have diarrhea. That means you're passing frequent loose stools, or you might have both of them occurring concurrently. So,
Does it just develop or you're born with it?
Well, the actual cause is not really known, but you have like things that can predispose the person to such a syndrome. So nobody's actually born with it, but it just comes up based on your lifestyle and your habits.
So you're saying that one could develop irritable bowel syndrome at any time, whether as a child or as an adult. Is that what you're saying?
Yeah, most of the times adulthood, yes. It can
Adulthood.
yes.
It could just develop.
Yes, it can.
And then you find yourself living with it.
Well, it's usually
Is it curable?
It's curable, yes, it's curable. Sometimes most of them can even phase out by itself, and it's also curable.
But you find yourself, whenever you eat, you start having either constipation, and then your stool is either loose or hard. And then you said caliber. That was a funny term to use for stool, but that the size of the stool would change.
Yes, the size, yes.
Okay. So are you saying bigger or smaller, or it could go either way?
It can go either way.
Okay.
Where it's bigger, that means you're going to be constipated.
Okay.
So it's just the caliber, it's just change. You know that there's a change in the normal pattern of the stool.
Okay. So is there a difference between the kind of pain that one would feel in a situation of IBS, which is also irritable bowel syndrome, and having a stomach ulcer?
Yes, because both of them, the conditions occur in different parts of the gastrointestinal tract, that's the intestine. I mentioned earlier that the stomach ulcers occurs in the upper gastrointestinal tract, while the irritable bowel syndrome and the diverticulitis occurs in the lower. So you expect that the pain for the stomach ulcers will be at the upper part of your abdomen, while that of the IBS, irritable bowel syndrome, will occur at the lower part of your stomach. So the pain differs.
Okay. So is IBS, could it also prove fatal? Could it be fatal?
Yes, it can be fatal. It can be fatal because most of the presentations that occurs in the patients, if they are constipated, you know what constipation can cause. You have abdominal distension, you might start vomiting, you have nausea, and it might cause a lot of obstruction in the abdomen, or you are passing too much of stool, you are getting dehydrated, the person can go into shock, so it also can be fatal.
Okay. So the pain for IBS would now present, since you say the lower part of our digestive system, would it now be presenting at the bottom, below your navel,
Yes.
below the belly button? Okay. Then let's move to diverticulitis. What happens in that particular condition?
Diverticulitis, it means there is actually an inflammation or infection. You can have diverticulosis, which is just a condition, because both of them are under diverticular diseases. So, but what happens here is just that there is weakness of the outer wall of the intestine, whereby the inner wall now protrudes and forms a pouch. So that pouch remains there. If it gets inflamed or infected, it now turns to diverticulitis, which can be very, very severe depending on the extent of the infection there and the location of the diverticulitis.
Where is one likely to feel pain in the case of diverculitis?
As I mentioned earlier, these diseases are actually diseases of the large bowel, that's the colon. So you expect that the pain should be at the lower abdomen, more on the left side of the abdomen.
Okay, you didn't say anything about direction when you were talking about IBS. IBS, left, right, center?
Well, IBS is also common to also on the left side. Both of them are both common on the left side, on the colonic side, the left side.
Okay. So, and could diverculitis also prove fatal?
Yes, it can. It can prove fatal because this is like a pouch. And because of the pouch and infection and inflammation, most of the organs that are adjacent to it, like in a woman, she can have her uterus adjacent to it, or her urinary bladder, or her ureters. With infections, they can form a tract. And from there, most of the contents of the intestine can track through that place and cause massive infection in the body.
So when you have a woman who keeps having pain, complaining of pain in the lower part of the tummy, it's not just the tummy she should be worried about, but also her reproductive organs.
Yes, she has to be worried about her reproductive organ because a woman with pain, so you have to also, part of the test you also do for them, women in childbearing age, you also have to screen them for pregnancy to be sure that it's not a pregnancy. Then you also check among other things that can cause pain in the lower abdomen.
Okay, so in the case of diverculitis, do you feel a different way? I know you have said to the left and below the belly button, but is there a difference to how you feel and how you pass your stool? Because you've talked about, the caliber thing of IBS, how the stool changes size and consistency. It could be loose, it could be very hard and compacted. But in the case of diverculitis, does it affect the stool? Can your stool lead you to start to suspect that there's something wrong, apart from the pain?
Besides the pain, they also have symptoms so similar to the IBS. Based on they have both of them, but the person can also be constipated. So one of the things that joins both of them, apart from the abdominal pain, is also the constipation. But the caliber is not really defined as to whether you're going to. It's not the pointer that tells you, okay, I actually have a diverticulitis, so I don't have.
Okay, so when we're talking about, when you have successfully told us quite briefly too and concisely what the major differences, or try to define for us what ulcers, IBS and diverculitis is. But I noticed that it was only for ulcers that you talked about vomiting being one of those things, and usually with blood. So are we saying that in the case of IBS and diverculitis, vomiting isn't exactly one of those major things that could happen?
So far as a digestive, so far as a gastrointestinal tract, that's your intestine, and there's any disease entity related to it, one of the commonest symptoms is nausea and vomiting, and probably diarrhea. So the only difference separating the irritable bowel syndrome and the diverticulitis from the stomach ulcers is that the ulcer, as I mentioned, there's always an erosion or a sore in the lining of the intestinal tract, which can perforate a vessel because of its location. So ulcers, actually, they can either perforate from complications or they can bleed. But irritable bowel syndrome and diverticulitis doesn't have this.
No perforations. Yes. So it's just generally still within but of course you said diverculitis, it could protrude such that it could touch on other organs and then cause infections.
Yes.
All right. If you're just joining us this evening, we're actually taking a look at the stomach and some of the common ailments that a lot of people have. Now, talking about causative factors, Dr. Eburaja, what are some of the things that could cause any one of these three stomach conditions?
Well, for stomach ulcers, that's the peptic ulcers. One of the major causes is like a bacteria called Helicobacter pylori, and aspirin, which is like a non-steroidal anti-inflammatory drugs, like a painkiller. Those are like the major causes of peptic ulcer. Amongst them, you can have other things, maybe like use of caffeine, alcohol use, smoking, starvation. Those ones also predispose you to stomach ulcers. While mainly for irritable bowel syndrome, you actually have it's more like a lifestyle um, issue based on your lifestyle modification on how you eat and your eating habits. Because most of the times, things that you take might just irritate the bowel, and you'll be having like stool urgency and the rest, or changes in bowel habits. So those are the things that actually cause this one, unlike um, your stomach ulcers. So also the diverticulitis, if the person also has an existing condition that's a comorbidity with the condition you're having, it can make it a little bit worse. So mainly your lifestyle and your habits, based on your eating habits and your lifestyle, are the major causes of the irritable bowel syndrome or the diverticulitis, unlike your stomach ulcers, where you can have your bacterial infection from H. pylori or use of painkillers like non-steroidal anti-inflammatory drugs. So those are the major causes.
Where does H. pylori come from?
Well, the H. pylori actually can be in the body. You understand? Because most of the times you have like overproduction of some of the bacteria. Some we have like some normal floras in the body. That means they live like in a symbiotic association with the body. And when there are some conditions whereby the organism is introduced into the body, it causes excessive production of acid, which goes ahead to erode the lining of the stomach and cause all those acidic effects by causing ulceration.
So it's naturally occurring.
Yes.
But when it starts to overpower other bacteria, it now becomes a problem.
Yes.
So is there, talking about treatment, by the way, we need to go on a commercial break. When we get back, we'll start talking about the kind of treatments that are available for all these conditions. Also talking about, but quickly before we go, also talking about causative factors. Can stress cause any one of the three?
Yes, for ulceration, stress is like one of the also causes of ulceration. If you have like physiologic stress, maybe due to trauma, severe illnesses, accident, burns, or meningitis, whatever infection you have in the body that is very severe that can keep you debilitated in bed, can cause ulcerations because they produce stress hormones, which goes ahead to cause ulcerations in the lining of the stomach. So stress is also one of the causes of peptic ulcerations, unlike the irritable bowel syndrome and the diverticulitis.
Okay, so stress is not an indicator of IBS or diverticulitis.
Yes.
Okay. All right, we'll be back with Dr. Andy Eburaja, still with us in the studio, talking about different stomach conditions. Like I said today, a lot of people complaining about tummy ache, and some of them we take lightly. We talk about, oh, just take this particular medication, and then somehow we just hear, and it was just stomach ache he was complaining of, and that was it. So let's go on this quick commercial break. When we get back, we'll be taking your questions. Like I said, we're live on Facebook, taking a look there to see if we have any questions. And then, of course, you know that when the lines get open, the floor will be open to each and every one of you. Do stay with us.
Your Health 360, only on Invicta 98.
Thank you for joining us. Back again, talking about stomach conditions, particularly talking about ulcers, irritable bowel syndrome, and some condition called diverticulitis. And Dr. Eburaja, Andy, has been talking to us about knowing the difference between these two. And it is time, like I said, for us to hear from you, because today we will have to leave before a quarter to the hour, to the top of the hour. So it's time for us to open up the phone lines now. Where are those people who talk about tummy ache, tummy ache, tummy ache? You want to know the difference? Time for us to hear from you. And the lines are open. The numbers are 081 40,099 and 070 989. Once again, that's 081 40,989 and 070 989. Okay. While we're waiting for your calls, I see Mercy David. Thank you very much. Mubarak Jibril Malam Himma. Thank you. Bize Ezekiel. All right. Watching live from Akwanga. Thank you so much. We appreciate you. Let's go to the phone lines now. Hello. Good evening. Hello. We're connected. Good evening. Can you hear us? Okay. I wonder what's wrong. Hello.
Hello.
Yes, good evening. Uh-oh. Hello?
Hello, can you hear me?
Yes, I can hear you now. Go ahead, sir.
My name is Benjamin Adiribigbe.
You're welcome, Benjamin Adiribigbe. Go ahead.
How are you doing? How is work today?
Work is going great. Benjamin, it's great to hear from you. All right, go ahead.
I just want to find out what's the difference between ulcer and palpitation. What relationship do they have?
Between ulcers and palpitation?
Yeah.
Okay. All right. So the doctor will answer you. Thank you so much, Benjamin. I've just got to mention that Benjamin is a former classmate. So great to hear from you, Benjamin, knowing that you're listening. All right. So let's move on to our next call. Okay, that call got dropped, unfortunately, before I could get to it. You can still call us. The numbers are 081 40,000 989 and 070 800 989. Hello, good evening. Good evening.
Good evening.
Yes.
How are you?
I'm doing great, sir. Thank you for asking. Go ahead.
I'm calling from Overedo.
You're welcome, sir.
In fact, since the inception of this program, I'm not hearing the doctor very well. Like he spoke about the words were not coming out to my own understanding.
Okay.
Like it was very far from the phone or thereabout.
So sorry about that. I apologize. All right. Hello, good evening.
Hello, good evening, ma.
Yes, you're welcome.
Thank you. I'm Dorcas calling from television.
You're welcome, Dorcas. Go ahead.
Please, can too much of thinking cause ulcer?
Too much of
thinking, and again, like one always have back pains, mostly at the back. You cannot bend down or if you sit down to stand up, it's a problem. Is it an ulcer?
Is the pain only at the back or in the stomach too?
Yes, the back, mostly at the back.
Mostly at the back. Only. Okay.
Yes.
Okay. But you said that thing you said the first. You said, can one have ulcer from, is it thinking?
Yes,
Okay. Yes. I've got it now. Thank you very much.
Thank you.
All right. Let's come back to Dr. Iburaja. Before I come to you, let's take this last call. Hello. Good evening.
Good evening, doctor.
You're welcome, sir.
Good evening to the doctor. This is Engineer Emmanuel.
Engineer Emmanuel, you're welcome.
Yeah,
Go ahead.
my question to the doctor is, what will be the cost of a stomach upset, unexpected one that was like a hell? The day I passed through that pain, I don't know what happened, but honestly, that experience, I never pray to have it again.
Right.
So I don't know.
Can you describe it quickly? Can you describe the kind of pain that it was quickly? Can you describe the pain? It was what?
It was something else. I was restless, uncomfortable. So I don't even know what really happened.
Okay.
So I don't know what may be the cause. So after that, I took some, I went to a pharmacy, then took one or two things. Then towards evening time, I got myself. Then there is something again.
So you abuse drugs, Engineer Emmanuel. You went to a pharmacy and took one or two what? You are abusing drugs too, Abi?
I know you say because I had you tell her they say abuse.
Yes, drug abuse, substance abuse. Drug abuse. This one is drug abuse, Engineer Emmanuel. Jokes apart, though, let's be very careful how we recommend things to ourselves.
Yeah, I understand. Even the day other girls gave some breakdown and this drug something, I was guilty. I was guilty, but now
you were pinching yourself. All right. Okay, so let's get doctor's feedback. Thank you so much, Engineer Emmanuel. Let's hear from you, Dr. Eburaja.
The first caller's question, she asked about ulcers and palpitation, if they are the same thing. That's the relationship between ulcers and palpitation. Now, for ulcers, they basically come from the intestinal tract. All palpitation comes from the heart.
Okay.
For both of them, palpitation, you hear like the sound of your heart beating. Not necessarily pain. You just hear the sound of your heart beating is in your chest. Also, the ulcers, you also have pain also in your chest. So this one has pain in the chest. This one you have heartbeat. You just hear your heartbeat. That's palpitation. So the commonest thing is that both of them occur in the chest because the part of the stomach also covers the chest, covers part of the stomach. And also, your heart is also embedded also in the chest. So both of them are like organs that are also located in the chest. But the difference is that this one causes pain, while this one you just hear your heartbeat, not necessarily pain.
So one cannot lead to the other.
No, it can't.
Having a stomach ulcer cannot cause palpitations.
No, it cannot cause palpitations.
Not even on someone who has probably high blood pressure.
The major relationships, there are some cardiac conditions where they present with palpitations. They might have like chest pain. They call them angina, chest pain. So they come with like severe chest pain. And some of them come down with palpitation. Unlike the ulcers, that is just basically a condition of the stomach that just comes with chest pain that radiates to the back.
Okay.
But for the palpitation, comes with it's a heart disease condition that can present with palpitation, but they also have chest pain, which is actually called angina.
Okay.
So both of them have similarities by having chest pain, but not palpitation. If it's angina, yes, but for the palpitation related to the ulcer pain, no. But angina and the ulcer pain, yes, because both of them cause pain in the chest.
Okay. So let's move on quickly to the next questions. We had someone talking about thinking. Can thinking cause ulcers or stomach pain?
Well, she mentioned about thinking causing stomach pain. Most times when people think, I have to believe that they feel they are stressed up. So, and what we mentioned earlier when we talked about physiologic stress causing ulceration. Physiologic stress causing ulceration. So if the person is stressed up due to illnesses, due to trauma, due to burns or whatever it is, it can lead to ulcerations of the intestine and cause about pain. So those are the things mainly. But thinking itself doesn't cause pain in the abdomen.
What about the back ache?
She mentioned about back pain. She wasn't really specific about the back pain. Also doesn't really cause back pain. But you can usually have what we call referred pain. Just because of the supply comes from the spinal cord and goes straight to the stomach. So when you have the ulcer pain, the pain refers back to where the spinal cord level, where the nerves are supplying it from. So usually when they have chest pain, it also radiates to the back. Not necessarily that back pain, because she didn't mention whether it was at the center of her back or the lower back that is causing the pain. So you should have had an epigastric pain, a chest pain that is radiating to your back before you can say, okay, this thing is actually related to ulcer. Not just every back pain is related to ulcer.
Okay. What about the engineer Emmanuel who was talking about acute, some kind of sudden stomach ache that was so bad?
Well, ulcer actually causes, you can have acute pain in ulcers. That means it just comes all of a sudden. And most of the times, there are things that will predispose one to all these kind of pains. It's either he's starving or either he has taken all these drugs that we mentioned, the NSAIDs, that's painkillers, or he hasn't eaten for a while and he now comes down with acute pain. So it's possible, but you have to find out, is it related to meal? Is it related to something he has taken? And where is actually the pain? Is the pain central and above the belly button, or it's lower? Where can be able to say, okay, this peptic ulcer, or this is IBS, or this is diverticulitis, or any other condition that causes pain in the stomach.
In closing, Dr. Eburaja, is any kind of stomach ache to be taken lightly?
Stomach ache shouldn't be taken lightly because a lot of disease conditions can present with stomach pain. So it's always advisable when you have stomach pain, like if it's mild, most people might just want to use maybe mild analgesics to take it to see if they're going to have relief. And if they don't have relief, they might need to present to see their medical practitioner.
Okay. Well, you've heard it from the doctor. Stomach ache shouldn't be taken lightly, particularly in these times, because I keep hearing about people complaining about tummy ache. Could be anything, actually, but I think it is it's better that we just find out what it is by going to the hospital. Engineer Emmanuel, this is hoping that you never have that tummy ache again, but you might want to watch and observe yourself so that you don't have that kind of acute condition coming down again. Well, I did warn us that we would have to go quite early today because we have a health advisory coming up shortly after this. Would like to thank you, Dr. Andy Eburaja, for being here this evening. Thank you, as always, for giving us your time and enlightening us. It was an enlightening 45 minutes.
Thank you, Jacqueline.
Thank you so much. Well, and this is where Your Health 360 calls it a day this Friday. Next Friday, we hope to come your way once again with another health professional, raising awareness and helping us understand what we should know about our health. Remain in good health and do stay with us.
Jacqueline Adebija.